The World Health Organization has urged nations to vaccinate at least 10% of their populations by September. The call comes as member states plan for the next big pandemic at the UN Health Body's annual assembly. For a closer look, Professor Paul Tambyah joins us now. Prof. Tambyah is from the Division of Infectious Diseases at the National University Hospital here in Singapore. Prof, what needs to be scaled up to achieve that goal of vaccinating 10% of people globally by September?
Well, in my opinion, the most important step has to be the patent waiver, which the governments of India and South Africa are campaigning for at the WTO. You know, there is actually plenty of manufacturing capacity for vaccines in Africa, many parts of Asia and Latin America. And once local manufacturers are empowered to produce WHO vaccines, local production can be scaled up rapidly and vaccines can be rolled out. I mean, this happened many years ago with the smallpox vaccine, which eventually eradicated smallpox. And it's close to happening with polio. You know, last year, in the middle of the pandemic, the WHO announced the eradication of polio from Africa, which is really amazing. And it shows that, you know, this can be done if you follow the right policies with good local primary health care.
There are also calls for the WHO to be given more powers. What could the reformed agency look like?
Well, frankly, I'm not so sure that more powers will actually help the WHO, because the WHO is currently limited by the fact that it is intrinsically political, like all UN agencies, and it's subject to, the veto powers of the 5 World War II victors. What the organization needs is more of what actually works. You know, the voluntary association of thousands of scientists, researchers, and public health officials who contribute to the GIS-AID database. You know, this is the database with all the genetic sequences of viruses. And it was set up after the World Health Assembly in 2008 in response to Indonesia's complaints about access to pandemic influenza vaccines for countries providing samples. And it's been a huge success. I mean, anyone can register. And if you agree to follow the rules, you have access to the world's largest database of any infectious agent, far more than influenza or TB. And this has allowed us to track the evolution of the virus, the appearance of the so-called variants, and it's also allowed countries to understand how the virus spreads within the country so they can target interventions.
Well, still on the role of the WHO, Prof. Tambyah, it's been more than a year since we've lived with this pandemic. And, you know, there's been still some wrangling over the origins of it. What role might the WHO play there?
Well, the WHO, again, can potentially provide the role of a neutral party. You know, the whole issue has been highly politicized with the previous US administration. There are 3 main theories that came out of the last WHO report earlier this year. Firstly, could it have been direct spread from an animal in a wild animal market in Wuhan itself? Could there be spread from an animal to humans in southern China or Southeast Asia, who then spread this to other people in Wuhan at the Huanan seafood market and then to the rest of the world? And thirdly, and less likely, a lab accident. So the WHO needs to be able to provide a safe means for individual scientists, researchers to deposit evidence, animal studies, early studies from blood banks or serological studies, and perhaps make these available in an anonymized and de-identified manner, like the genomic database. So anyone who agrees to the terms and conditions can have better access to the data. And that way we can understand how the pandemic developed. It worked with SARS. And it's vital because otherwise, you know, when the next pandemic hits us, we're going to be no wiser.
Yeah, speaking of the next pandemic, countries are looking to prevent that from happening. What are the major areas of concern?
Well, for me, the biggest area of concern is that we will get an influenza pandemic very soon. You know, we haven't had any influenza in most parts of the world since the middle of last year. And my fear is that a novel strain of influenza, perhaps from birds or pigs, will suddenly appear, start killing children, and the whole world will go into a lockdown again. I think we need better calibration of the pandemic response and perhaps even faster vaccine development and use of antivirals. And in fact, that's one silver lining from this pandemic, is that we have a whole range of new vaccine technologies we never had before. By the time the next pandemic rolls along, we'll have had more experience with these new technologies, and we'll know which ones can be quickly and safely adapted to the new pandemic of influenza. There are, of course, other concerns exposed by this current pandemic. such as how vulnerable people in rich countries are, and how fragile many healthcare systems are, especially in middle-income countries. And also the inequities exposed by the vaccine rollout will have to be addressed. The challenges before this WHA are immense. I can only hope something positive comes out of this meeting, but frankly, I'm not that optimistic.
We all share that hope, Professor
Thank you for sharing your
Tambyah.
thoughts with us.
Thank you, Professor Tambyah. That was Professor Paul Tambyah there from Singapore's National University Hospital.